tonight. And so I'm going to, hey, Dr. LaRue. So I'm going to tell you all a little bit about her, and then I'm going to give her an opportunity to say hello to the people. So, as usual, now you all, we are back on StreamYard tonight. So, we are streaming live to my Facebook page, my personal, as well as Heart and Soul Facebook page, as well as my LinkedIn. So, wherever you are tuning in from, by all means, drop hello, hey, how you doing, what it do, whatever you want to say, drop it in the chat so we know that you are here. And also, if you have any questions, because tonight is really about information and making sure that people understand the process for initiating mental health services, right? So, if you have any questions, please, please, please drop them in the chat and we will get to them. Okay. So, let me tell you a little bit about Dr. Damita. So, she is a Cherokee grandma, an international trainer and speaker, and of course, a psychologist. She loves speaking to women from marginalized backgrounds who struggle with chronic illnesses and pain that, of course, we know can be exacerbated by the trauma that they've experienced. She is passionate about helping women grieve the losses that they have experienced due to their health, trust the wisdom of their bodies over the voices of the experts. Y'all, I'm going to say that one again because that is important. Trust the wisdom of their bodies over the voices of the experts. And she also is passionate about exploring effective alternative treatments and educating women about the impact of trauma on their health. Dr. LaRue is the founder and CEO of DLA Psychology Center in Chicago. And she also, y'all, is so awesome that she actually lives on two sides of the country throughout her time. So, in addition to running an entire practice, having multiple certifications, caring for the people, helping all of the people, she also splits her time between two locations. All right. And she also has advanced training in clinical hypnosis with uses for her patients to support them with pain management, insomnia, cancer, and other medical conditions. So, you all welcome Dr. Damita LaRue to the show.
Thank you so much, Dr. Christie. That is amazing. I'm really excited to be here tonight. With Mental Health Awareness Month, definitely has my heart going. So I'm ready. What you got for
Yes.
me?
All right, so let's jump in. So, y'all, you know it is Mental Health Awareness Month. And so you probably have seen a lot of posts out there with different facts and figures and different coping strategies. You all, please pay attention to all of the good information that you are seeing. Okay. Make sure that you are paying attention, you are taking notes, and make sure that you are also taking notes of the mental health providers who are being visible. And so for me, this mental health awareness month, who's being visible is important. And so I'm gonna tell you all a little short story, and then I'm gonna give Dr. Demita our first question. Okay. So a couple of weeks ago, I was doing a vendor opportunity with the Healthy Kids Day at the YMCA. So much fun, right? It's a gym full of kids, all ages. There were teens, there were young kids, there were arm babies, and of course, there were adults because it was for families. And there were so many different vendors there. So there were woodworking vendors, there were bouncy houses for the kids, there were insurance companies, there were people there with education. So there were some teachers there. And then, of course, there were mental health providers and medical physicians there as well. And so, people would come up to my table and they would look at all my stuff, and I had journals and pens out because in psychology we talk a lot about being able to track your thoughts and journaling and how that can be helpful. And this one cute little black girl came up and she whispered to her mom, and her mom said, ask your question out loud. So she asked me, she said, what is a psychologist? And so I gave her my kid friendly answer. I said, a psychologist is someone who helps us when maybe we have some issues that we want to work out. They talk to us about how we can do things in a way that'll help us meet our goals. And a psychologist helps us to be happy, healthy, and whole. And Dr. Demita, her eyes lit up and she said, oh, wow, that's what you get to do. And I love the wording, right? Not that's what you do or that's what you have to do. She said that's what you get to do. And I said, yep, that's what I get to do. And I love it. And in that moment, it hit me that she had probably never seen a psychologist before, right? But definitely had not seen a Black female psychologist before. And I knew that that was kind of where I wanted my focus to be for this mental health awareness month, because we do this every year, right? Like this is a big deal for us. But for this mental health awareness month, I really wanted to focus on who's visible. Are people seeing the faces of the mental health providers that are out there? And so I want to ask you, what is this mental health awareness month about for you?
I believe that your story is just spot on and perfect because, as a grandma
Mm,
of biracial children that are both Cherokee and Black, they do present as Black. And when they go to school, they talk to all their friends about their grandma. And what they say is, Grandma's an emotions doctor. That's what they all call me.
I
So when
love
I come to school and pick up the kids, it's the emotions doctor is here to pick them up.
it.
So we try really hard to make sure that the stigma is decreased by making it normalized. And
Mhm,
I believe that mental health awareness is letting people know that if they're struggling, they're not alone. There's help out there, and helping them find the help they need in the way that's just right for them, because it's a special relationship to go to therapy.
yeah.
You have a different kind of connection. So
Mhm,
letting them know that when we share our experiences or our stories and even our truths, then people really understand what mental health is. And then
mhm,
they're not fearful of it, because so much of our culture is got it wrong. There's so many myths out there that it really can be bothersome. So, really normalizing mental health from a very young age
mhm,
and allowing the kids to have that experience, and for them, for my grandchildren and the kids they go to school with, it's more normalized because they talk about it. And
yeah,
then they see two little children with Black skin that are in therapy and excited about it. They love going to their emotions doctor,
I love it.
just because we normalize it. And I think that's one of the biggest things, is letting people know they're not alone and this is normal and okay, even though you may have been told something different in the past.
Absolutely, absolutely. And I love that part about starting it young. And so that's the piece that I think, one reason I love working with kids, right? I feel like when you're younger, you haven't you haven't been so jaded, right? Like you haven't had those experiences that make you look at the world in one specific way. So kids are usually very open-minded, and if you present something to them and if you are consistent and you are safe, they will believe what you tell them, and they will take that and they will keep that for the rest of their lives. And so if we can give them skills and tools and coping strategies when they're young, they will still have those with them when they become adults. And they'll know, right? Like therapy is a resource. It's not a punishment. It's not something that you have to do when something is wrong with you. It's something that you get to do so you can become the person that you want to be. Yeah, absolutely.
Absolutely.
Yeah, yeah, I love it. I love it. So, Doc, tell me a little bit about how you increase mental health awareness. I know with the babies, right? Like they know what an emotions doctor is and they talk about it. But what are some other ways that you increase awareness of mental health in the communities around you?
I believe that the most important thing is for us to be real. If we have had any experiences or stories of someone we've known or of ourselves, if
Hmm.
we share those and be authentic about it, it really normalizes it for others. So I share and have always shared that therapy has been a part of my life. It's
Yeah.
something that I enjoy, I look forward to, because I need that extra person to just help me figure things out, because sometimes it gets cloudy or lots of cobwebs in that brain, and we kind of need to pull things apart, and we need that person who's like the outsider looking in so
Uh-huh.
that they can help us because we get all caught up in our mess. And sometimes we need some help to understand what that mess is, pull it
Yeah.
apart, and go, oh, this is what's happening. Now, what coping skills can I use? What strategies can I
Right.
use? So I really believe that when we share our truth,
Mm.
even though it might be uncomfortable at first and it feels vulnerable for sure, it makes such a huge impact because people go, oh, you're a doctor and you go to therapy? And that kind of blows their minds. And I'm like, absolutely. That's how I'm a good doctor, is
Yeah.
because I go to therapy.
Yeah.
And I get that outside perspective. So I believe in really being honest and real
Yeah.
and letting people know that. And then, like you talked about your event that was in the community, we
Mhm.
do that a lot as well. We dive out into the community, talk to people. When there's events, I always make sure we have a table. And then we do things to draw people in that are creative and
Mm.
also therapeutic. So that's a lot of fun because if you can make it back to your story of getting to do it, then
Right.
people are so much more open to it, no matter what their age is. Because we all have a kid inside of us that says, not so sure about
Right.
this.
Right.
And so it's like, okay, I can let my kid actually out and say what I feel, and I'm going to be well received because I'm being real. The more real we are, the better off everyone is. And
Everybody will be.
it
Yeah.
ripple effects through our community, and people see you on the street and they're like, I forgot that's that doctor and she talks about therapy. And I'm excited when that happens, and
Mhm.
instead of being embarrassed. So it's really, how do we feel about it, how do we posture it, and how do we talk about it, especially when there's so much in the news and in the world that can be incorrect when it comes to this topic, for sure.
I love how politically correct you are. When you say that, right? It's so much that can be incorrect. Absolutely. There is so much that is absolutely incorrect and sensationalized and all sorts of things. And it really does a lot of times serve to further that stigma. And so I do feel like it's part of our job as mental health providers to make sure that we do what we can to decrease that stigma. All right.
Absolutely.
And I love connecting with the community in order to do it. I see my sister Glennie is on. Hey, Glennie, thank you for being here. Um, to kind of answer that question myself, doing those events, making sure that I'm vocal. I love that about being honest. So, because we were talking off camera a little while ago, we both have a lot of trainees that we work with. And so, even with trainees, I have to make sure that they're aware that I'm in therapy. Now, you don't have to tell me about your therapy, that is your business. I have no problems telling you about my therapy, right? Because that is, like you said, how I make sure that I am a good therapist. That's how I make sure that I am doing what I need to do to be happy, healthy, and whole. And so that's what I take into the therapy room with me. Right. And, a lot of times people, even in our field, will want to be a little tight lipped about their strategies or the things that they're doing. But why? Right? This is what we are recommending to other people. So why not actually share that information with others? So,
Absolutely. I love that. And one way that I do it is on we have a calendar for the whole company.
mhm,
And it's funny because I put on there my therapy. I just say therapy. They don't know who my therapist is because I do
mhm,
believe that's private.
right.
But I put on therapy, and everybody knows that's the hour not to bother me.
Yeah.
And I've noticed one of those things, when people watch you, they emulate you. So
Mm.
now many of my staff have their therapy posted on the calendar. And that makes me so excited because they're owning it
Right.
and they're being visible with it instead of ashamed or even drawn back a bit about
Yeah. Absolutely. I love it. I love it. And when we own it, then we are able to have these conversations, right? When we're out with other people, and it'll just come out. Kevin always kind of jokes about like we can't go anywhere without somebody telling me their whole life story. And I don't have to tell them that I'm a psychologist for people to just talk to me. But even before I became a psychologist, I talked a lot and I like to talk to people. So I don't meet a stranger, right? But even just recently on a trip, the trip I took right after we came back from Florida, when I flew back to Florida, met a guy on the plane, and we ended up sitting next to each other on two different flights. So one flight going to Florida, and then 3 days later, the flight going back to Charlotte. And right, like that. And I don't, I'm Christian, I don't believe in coincidences. Right. And so we were talking about like how weird that was that we ended up in this place together twice. And we started talking again on the way back. And he asked what I did for a living. And I know a lot of people would say, oh, I'm a counselor. Like they would say something other than what they actually do. And I said, I'm a psychologist. And he perked up and he had all of these questions. And it actually led to a really great conversation about dialectical behavioral therapy. And I'm sure the people
Wow.
around us was like, what are y'all talking about? But it was a really good conversation. And I helped to connect him with some people for a family member of his that needed some mental health help. And I just felt like that was God saying, like, you need to make sure that you are doing these things. Seize the opportunity to talk about the gifts that I've given you so that they can help others. And so I think that's for me, that is how I'm trying to increase awareness. Had someone reach out this morning and they said, hey, I know it's last minute, but we are doing these mental health awareness videos at church every Sunday. Is it possible for you to do like a 2-minute video for this coming Sunday? And I was like, yeah, right. Like
Absolutely.
I'm doing Facebook lives all the time. I'm doing videos all the time. Sure. I'll do a 2-minute video talking about mental health for kids and teens. Not a problem. And I love that it was being shown in church because sometimes that's one of the most difficult places to get people to come in to therapy is in the church.
Absolutely. I know the church that I have went to here in my neighborhood, they do a video and then they have anybody in the church who is a mental health therapist of any kind. They have us all stand up and wave so everybody identifies who they can go to if they need referrals, and what that looks like. And that's quite lovely because, yes, church was one of the challenges for me many, many moons ago, because it just wasn't supported. So I love that the churches are getting more aware of mental health issues as well as making a stand and advocating for it.
Absolutely. Absolutely. It's so great to see that people realize you can have God and a therapist. Right? Like
Yes.
you can have both. God is not going to be upset with you. I promise you all, God made therapists. All right.
Yes.
So you can have both. Absolutely. All right. So our next question, when we think about mental health awareness, I always say, right, like it's a lot of us as mental health providers, but it's not as many of us as it is people who need help. And we know that because we see our wait list. We know how long it can take people to actually get into treatment. And for everybody that's watching, we are going to talk about how to initiate services in a few minutes. But I wanted us to really kind of think through as community members. Doc, what are some things you think that community members can do to increase awareness about mental health concerns, and also mental health treatment?
I believe one of the biggest things is kind of squashing those myths when they come up. So when we have a shooting or we have some other violent event, and
Mhm.
then people say, "Well, they must have been mentally ill or whatever,"
Mm,
really kind of squashing that stuff and say, and standing up and saying that may be one of the issues. However, statistically, research shows us that often that's not the case.
mm-mm,
So I think one of those things is really empowering everyone listening, everyone around us to stand up and advocate, when they hear something that's not right. Because
mm,
it's so easy for us to go, that's somebody saying this or whatever. I don't want to step on their toes. And yet, I believe that if we know something to be untrue, we need to stand up and say it.
You say
So
something.
really advocating is just a it's such an important thing for us all to do.
Mhm.
And then challenging people's beliefs and thoughts in a healthy way, but challenging what they like automatically go to,
Mm,
because our automatic thoughts are not all that. They come in and we think they are, but they're
okay.
really not.
No.
So even spending time with our friends, and when conversations come up, I mean, we all know there's lots of violence or pull out politics, and all these things come up in conversations. And often mental health myths pop
Mhm.
into those conversations. And it's always
Immediately.
interesting to me how often that can happen.
Uh-huh.
And so, really being honest and truthful and saying, that's incorrect, especially if somebody is saying, that somebody has a weakness because of mental illness. No, it's not a weakness. It's just like my granddaughter has diabetes.
Mhm.
She didn't do anything wrong. She has diabetes, mental illness, and it happens. And
Mm,
so just being okay with that and going, just like we're going to the doctor to get insulin or to get anything else, high blood
mm,
pressure medicine, we're just going to the doctor to get some help with our mental health. And we're actually showing how strong we are by going. So
absolutely.
really reinforcing the positivity, and even with our littles, oftentimes parents, we see kids starting at age 2 in my practice, and some parents feel like, oh, I'm a bad parent because I'm bringing my kid to therapy. And I'm like, you're a fantastic parent, you're
Right.
bringing your kid to therapy.
Right. You're giving them the tools.
They're gonna learn.
Yeah, you're giving them the tools that they need. Yeah.
Exactly. So reinforcing the positives, everybody can do that.
Yeah.
Everybody that can see what's going on. And, when people say something about somebody who's homeless on the street, this happens all the time. And people say something inappropriate, or, they must have a mental illness, they can't hold down a job. No, not true. So really saying, I reject that belief, and
Mhm.
I'm going to stand up and say it,
Yeah.
because we have more power than we give ourselves credit for. Every one of us.
Yes, we do. And I think that's one thing I love about mental health. And we were talking about this backstage, so to speak, but being able to empower the people that we see. Right. It's not my job to do everything for you. It's not my job to fix you. That is not what we're going for here. Right. I
Mhm.
am here to give you tools and skills that you can use. And I am bringing the expertise on psychology, but you are bringing the expertise on you and your family. And so, what I want to do is empower you to use these things to make your life what you want it to be. It's not about what I think it should be, it's about what you want it to be. Right. And that's why we are client driven or patient driven and patient centered. And I think, like you said, these misconceptions, it's funny when I hear my friends advocate for mental health, right? So like they're not mental health professionals, but because they know me and because we have these conversations all the time and because a lot of them are doing their own work, right? They're able to stand up and say to folks like, "No, that's not right. That's incorrect. Let me tell you what's really happening when you go to therapy." Or let me tell you how powerful you really are to be able to go into the room and be vulnerable with someone and actually ask someone for help and then actually take that help and do something with it. Yeah.
Absolutely. That is so important, because the reality is, when somebody walks into therapy, we're not telling them what to do, and we're not taking away their power. We're doing the opposite. We're empowering, focusing on autonomy so that they can take back their lives in healthy ways. And that's the power of therapy.
Absolutely. Absolutely. So this just popped up, y'all. This was not one of the questions that I gave Dr. Demita, but this happens sometimes. We're going to roll with it. What are some of the myths that you hear? And I want to start because when you said what you just said about we're not taking away their power, I thought of one. So, long time ago, before I got married, when I would date, people would find out what I was in school for or what I did for a living, and they would say, "Oh, so you're reading my mind." No,
No.
I'm not a magician, I'm not a telepath, right? Like, that's not what's happening here, like, it's not some magic going on. I just simply am learning about human behavior, and human behavior, as much as we don't wanna say it, because everybody's unique, and we are, and we're beautifully and wonderfully made, behavior is pretty, what's the word? Like, predictable. And so that's why we are able to do what we do the way that we can do it. I see hubby is on because he put some. I said it was a long, long time ago, hubby. Long, long time ago. Like way, way before. Right? Way before. Mhm. But yeah, we're like humans are pretty predictable. And so we can do this study of behavior. We can do this mind work. And it's not magic, it's just what we've been trained to do. But that is something, even now, like when I meet new people and they'll say, "Oh, are you reading my mind?" Mm-mm. That's not what's happening. No, I'm not.
I go to parties and people say, "Are you analyzing me?" And I said, and I've now gotten kind of sassy with it, and I'll be like, "Are you paying me?"
Mhm.
Because
That
I'm
part.
not working, I'm off the job, and whatever I might think, it's just me thinking. It has nothing to do with what my job. And people are like, "Oh, well, I just thought you analyze everybody." And no, I don't have the
Mhm.
energy for that. I see the
That
people that come in
part.
my door.
That part, right, and people don't realize that, like, yes, it's called talk therapy, and I know some therapists don't even like for us to say talk therapy, but, I mean, we are talking, and there is work happening, right? And so that work takes brain power, and so, no, I promise you, I am not purposely doing work outside of work. I'm not. Alright, so that is definitely another myth that I've heard. Also, this myth of whether or not someone is strong or weak because they're in therapy, right? Or a lot of kids will come in and say, "Well, I'm not crazy. Like, I don't need to be here because I'm not crazy." And we have a whole conversation about the word crazy and how we don't use that in my therapy room because one, it doesn't tell us anything, two, it has a negative connotation. But like this idea that you can't just get help for typical concerns. And so
Well,
we
one
have
of the
to
one
that.
of the ones I run into a lot is that, well, I don't need therapy. I don't understand. I need to just snap out of it. And I'm like,
Mm,
"No, it's
yeah.
okay, sweetheart. We're gonna help you." Because and people often say to me that they feel broken. And I
Mm,
reinforce, you are not broken. You are just who you're supposed to be.
mhm.
And you just need some tools. And
Right,
I can help you with tools. You
right.
teach me about you. I'll
Yeah,
teach you about the tools. And that's how we come together.
yeah, yeah,
And it's such a beautiful relationship
yeah.
in the therapy room. And other people say, that, well, I'm here because I have poor character, is what my mama says. No,
Oh,
baby. No, baby. You don't have poor character. You're beautifully made. We're
yeah,
just going to help you get what you need to be able to express your emotions in a healthy way so that you feel good.
yeah.
So I think and then the one that really just sends me off the roof is all mental health people, all people with mental illness are violent.
Mm,
No,
not
because
at all.
they get scared, or
Yeah,
they're like, "But I'm not like the bad people." No, no, no,
yeah.
no.
That's not
They're not correlated at all. They're separate. So just really being upfront and honest with them when these things kind of start to roll up and pop out.
absolutely, absolutely. We have a question, so I'm gonna show it on the screen. So Dr. Walker said, "Are there tips to help lay people understand the different types of help available?" And absolutely, right? So I'll let Doc start with that one, and then I'll bring up the rear.
I like the way she put me on the spot on that one. There are all sorts of tips to help us understand the different types. When somebody first asks me, a lot of friends in that family will go, "I need a therapist. What do I do?" So, my basic go to is that there are different kinds of therapists, there are
Yes.
different kinds of interventions. The most important piece to me, now, Dr. Cece may have her own, but for me, it's that connection.
Absolutely.
So these therapists, myself included, most good therapists will offer a free consult just so that you meet them, whether it's on the phone or video, for a few minutes, just to assess, do I feel like I can be honest and vulnerable with this person?
Hmm.
And then if they don't have that good feeling, I tell them directly, find another one, even if it's in
Hmm.
my practice, because I want them to feel good when they walk in that door and
Yeah.
know that they're going to get the proper support. And there are so many, as Dr. Walker puts in here, there are so many different tips. There's different types of therapy. Some people are more concrete and directive,
Hmm.
and you get homework and you do that in between each session. Some people are more relational and they're just going to have some chats, but they're going to challenge you at the end of the conversation.
Hmm.
We use different tools like dialectical behavioral therapy. It just helps us understand how the mind works. Because when we understand the mind, we understand so much about our emotions and our behaviors.
Yeah.
And then there's cognitive behavior therapy. We use that all the time to help people be aware of their automatic thoughts and understand what triggered it, what
Hmm.
the emotion is, and what the behavior is. And it's a triangle and it makes so much sense. So there's so many different ways.
Yeah.
My biggest recommendation to people is to talk to the therapist, tell them what you're dealing with, and honestly listen to your gut. If your gut says run, Charlie, run. That's just the best way I know to say it. If it says run, run.
Absolutely. And so I will 100% agree with Doc that the relationship is the part that matters. So there are numerous types of therapists, right? Like Doc just said, we have CBT, DBT, we have people that lean more towards ACT, which is acceptance and commitment therapy. You also have our psychodynamic folks who have their place. I actually enjoy some psychodynamic work from time to time. And so you really want to make sure that you are in a relationship with your provider where there's trust, there's honesty, there's respect, right? If you have those, you can really go to any type of therapist and you'll do just fine. Right. So it doesn't matter if it's CBT, DBT, ACT, psychodynamic, whatever, as long as you have a good relationship with the therapist and you are doing work. Okay. Now, Dr. Walker knows that this part is important to me. Make sure that you are with someone who has been trained. Okay. So we want someone that's licensed or we want someone that is working under someone else's license. So we want someone who has had formal training, right? So there are a lot of self-help books out that have information about CBT, DBT, ACT. Those are all great as like additional things, but you want people who have been trained to kind of walk this journey with you. Okay. Because unfortunately, there have been people who have experienced harm in therapy just because the person was not trained to do the work that they were trying to do. Okay, so training matters, relationship matters. And then I think sometimes people don't realize all of the different things that mental health providers can do. So yes, we do therapy. Yes, we address anxiety and depression and OCD and suicidal ideation and self-harming, but we also do things like career planning. We also do things like goal setting, executive functioning, right? All of these different things that help you function in your life, your mental health provider can probably help you with it. And if they're not the appropriate person, they will definitely help connect you with the type of provider that you need. Mental health providers also do assessment. So, IQ testing, academic functioning testing, all of those things. Like if you need accommodations for, this happened recently for the LSAT, right? You would get that from a mental health provider, usually a neuropsychologist or a psychologist, someone who can do the testing needed and then provide the recommendations. So, a lot of things are housed under mental health.
I want to add some things on there now that I'm listening to your list,
Mhm.
because people who have medical illnesses
Mm,
often feel so alone. So
mhm,
my entire practice, what our niche is in the world, is we work with people who have chronic, acute, and terminal medical illnesses. And we're even by their side as they leave the earth and when they die. And so there's so many things that we can do. Just saying we're psychologists doesn't really cover what we really do.
mhm,
But then there's also, back to Dr. Cece, what she said about training. Training is imperative.
mhm,
I see a lot of people like, we call it put up their shingle and say, I'm a this therapist, but they've never had that kind of training. So one of those areas is grief and loss. A lot of people say they are. However, not everybody gets that extra training because it's not really taught in school. So you have to go outside to get that training. One of the things I'm passionate about is everyone in my practice is working towards their certification or they have received it in thanatology, which is death, dying, and bereavement, because
mhm,
I don't want people coming to us and their person died or someone died due to suicide and the clinician doesn't know what to do.
mhm,
So our specialties are working in that mental health as well as the grief and loss area. So you're going to see different practices have different specialties, and that's really important. There's people that focus on eating disorders. There's
mhm.
people that focus on people who have those severe mental illnesses such as schizophrenia and psychosis. So you want a back to assessment. We also do assessments for people who are going to have medical procedures. So
Mhm.
my practice is very medical focused, but these things are things that you don't even realize you need until you find out from the doctor.
Yeah.
So things like spinal cord stimulators, bariatric surgery, all of these things, they need a mental health provider to help them to assess and make sure that they're safe and that it's the right medical procedure for them. So there's so many things. We could talk about what a therapist does all night, but I did want to throw that in there because that is such an important piece, and many people don't know that they can go to a therapist to get support with their medical illnesses.
Absolutely. And Dr. Walker knows that's one of the tips that I give when we start talking about initiating treatment. And so we'll kind of move over into that. But starting with your physician, right? So people will go to a medical doctor before they come for mental health help. But your medical doctor, a lot of times, will tell you, you probably need to go see a therapist, right? Like, I'm going to do what I can on my end, but some of this might be more emotional, it might be more, psychosocial in nature. And so let's get you over to a mental health provider. So one of the tips that I always give people when they say, well, how can I find one? You can start with the providers that you already have. Ask your physician. If it's for a child, ask the child's pediatrician if they know of any mental health providers. Yeah. Yeah. So
Absolutely.
Doc, let's move over into that a little bit. So, what are some tips you have for helping people initiate treatment?
One of the first ones is that a reminder that you've got courage. You are being courageous by making those phone calls. Don't be hard on yourself. Give
Mm,
yourself grace and know that, yes, it can be difficult and yet you're going to reap the rewards.
yeah.
So, really pushing through that fear and using that courage and knowing that no matter where you are, there's going to be somebody that can help you,
Mm,
and look for those because that's so important. And then there's a ton of websites. In fact, later on, we're going to do in the chat, we'll show you a link. If you click on the link, I will send you a document that really is tips for finding a mental health therapist and all the, not all, because I could never come up with all, but many of the websites. Because what you want to do is you don't want to hurt yourself through the process.
yeah.
So, because you're letting your heart open. And when you do that, you have to be protective of it, but also vulnerable. Both of
Mm,
those are so important. So when you're looking, you're really going, I mean, all of us have our pictures because we want you to see, can you connect with us even
mm,
in the picture? If it's somebody you're like, oh, I'm scared of them, No. Also, be real. Are you looking for someone with a specific gender or
Mhm.
race or culture? Because that's important. You
Yeah.
get to choose. You get to choose. And then, of course, insurance has to be on there. If you have insurance, who's on your plan? But really thinking it through of how can I do this and how can I sustain it,
Yeah.
both emotionally and financially. And are you looking for somebody who identifies in a specific way? Are you in the LGBTQ community and you want someone who also identifies that way? So it's really important. Religion, church. Do you
Mhm.
have somebody who's going to be with you on the journey, or are they going to shut you down every time you talk about something?
Yeah.
So those are the first ones that come up for me, as well as the things we've already talked about: training, certifications, as well as their degree. That's really important.
Absolutely. Absolutely. And y'all, I know this sounds like a lot, like it sounds overwhelming, and the process can be overwhelming. So, any way that you can get some guidance, any way that you can have somebody walk this journey with you, absolutely do it. I tell people all the time, you don't even really have to know me. If you know someone that knows me, right? If you can get a message to me, I will do my best to try to help you initiate services. Now, where we run into the issue is people will message me and say, "Hey, I heard you speak," or "Hey, my friend told me about you and they love you. Can you be my therapist?" So that's not going to always be possible, right? Like it's actually usually not possible because my caseload stays full and because I only see people in my area. But what I can do is help connect you with people in your area. And I am more than happy to do that because it's difficult when you're already experiencing concerns and then you're trying to maneuver this process, and the process can be daunting. It can. Right now, I know of practices and institutes and hospitals with a wait list of about 6 to 8 months for therapy. Right. And so if you or your child is in the middle of a mental health crisis or it feels like it's a crisis, hearing 6 to 8 months sounds just unimaginable. And there are still ways to, get on people's what we call the cancellation list. So you're already on the wait list, but then you tell them, add me to your cancellation list. So if anybody calls and cancels, you can call me and I will be ready for that appointment. That has moved multiple people up on the list. Okay. Also putting your name on multiple wait lists and taking whoever calls you back first, right? So doing the things like that can kind of help us along the way, because right now, you all, we are in a mental health crisis in our country. We definitely have way more people who need help than we have providers, and y'all, we are doing the best we can, and we know that there's more to do. There's more that.
Absolutely. And when you call a place, just asking them, can you help me?
Mhm.
And I mean, I know our office manager, she is trained and she has all these resources and she
Mhm.
will help them. And even if they speak a different language, if they speak Spanish, then she will intervene on their behalf to help them connect to services
Yeah.
because we want to help. And so it's really important to just say, if they say that there's a wait list, can you help me? Do
Mhm.
you know of anybody who can help me?
Yeah.
And we have some magic behind the scenes sometimes, not always.
Okay.
Uh, so we have these listservs and these people that we
Yep.
go to, and
Mhm.
sometimes they'll tell somebody that they're full, but they're actually holding them for a friend.
Right.
And so I can call and say, "Hey, this is Dr. Damita. I really need X or Y," and they'll be like, "Well, I had an invisible spot. I'll put them
Uh-huh.
in."
Uh-huh.
So getting help from the providers, because most providers, they really want to help, and
Yeah.
so just asking is super helpful.
Yes. Now, Doc, I explore my friend, right, like resources all the time. And I encourage them to do the same, and they absolutely do. But they usually know when I'm calling, right? It's like, you have a patient for me? Yes, I do. I have someone that absolutely needs help, and here's what's going on, and this is why maybe I can't take them or somebody else I know can't take them. What can you do? So Doc is absolutely correct. use the resources that you have. Right. This is what I tell my kids in therapy. This is what I tell the kids in my life and the adults in my life. Use your resources. If you know a therapist, if you are on this live right now, you know at least one therapist, right? If you know a therapist, right? You have doc now too. If you know a therapist, reach out to them and don't wait. That was one of the tips that I gave in the video that I did for the church today. Do not wait until we are now in crisis. As soon as you identify that there is some type of concern, if you identify that your child is more withdrawn than they used to be, your child is sadder than they used to be, your child is having difficulty going to school, your child's grades have dropped, you are having difficulty getting through the day, you are having difficulty going to work, you are worried about more things than you used to be worried about, your mood is different, it goes up and down more than it used to, your fuse is shorter than it used to be. Those are all reasons to at least go and initiate services. Have someone do an evaluation. They might say, hey, this is a typical response to the things that you have going on in your life. Let's meet for a few sessions. Let's talk about like ways you can decrease stress, and you're probably good to go. Or they might say, you know what, looks like this might be the start of some anxiety, or this really does sound a little bit like depression. Let's do some longer term work together, right? But you want to start that before you're in crisis. You want to start that,
Absolutely.
before the kid is failing, right? Yeah. Well,
I
go
also
ahead.
want to bring up something that this is a workaround we've come up with, and I know other practices here in Chicagoland definitely are doing this. But when the parent says, we can only see a therapist after 3:30, that's hard because most all of us close.
Mhm,
Now, so we also, yeah, and everybody wants those slots. Let's just be
mhm,
clear. So if your child is in a school in the neighborhood,
mhm,
what we do is we call the school and we say, we want to set up a room where we can come to school and do therapy. So we do it in all the schools in our neighborhood
oh, that's
as needed. So the kids are in school and they can be seen on our schedule, and we just transport ourselves over there.
okay.
So if you get really creative as a mom or a dad or
Mhm,
grandma, you can say, hey, would it be possible for anybody to see my kid during the day at school? Because I know those after 3:30 slots are hard to get. And it
absolutely.
opens the mind of the practice you're calling. And they're like, oh, maybe I could. We didn't intend to start this, but our therapist had day appointments and we had so many kids. So
Mhm,
we just started figuring out where the schools were. And the schools are so happy because it's helping the kid have a better education
right.
experience. And the teachers are feeling the support because the kid is getting their support at school. So always try to think outside the box, even for our people who work. Everybody wants it after 5. So we've learned to, try to say, can you do a video at lunch? Can you do
Mhm,
11 o'clock lunch?
mhm.
Or can you take your break early and let's do a half-hour session? We
Yeah.
get really creative. So you can get creative too, and you can ask for those things.
Yes, absolutely, absolutely. Now, Chicago sounds like they are doing an amazing job. I love Maryland, and Maryland is not they are not allowing us into the schools like that. But like you said, we have to find workarounds. So one workaround has been there are a lot of school psychologists in the school systems here in Maryland. And so sometimes we do have to transfer our services over to that person, and they will do weekly therapy with the kids, which is awesome because we know that that doesn't always happen, right? But
Amen.
we do see that quite a bit around here. Also, in thinking outside of the box, we will ask, when is your lunchtime? Is there a parent that can go pick you up and bring you to our office, and you bring lunch with you, right? And we do therapy, and then you go back to school. Or when is homeroom? Because homeroom, like, you have to be counted, but and hopefully everybody knows this, when you're doing a doctor's appointment, which includes therapy, you get an excused absence. So your child will not get in trouble for not being there. So what parts of the day, even if they are in school, what parts of the day would you be able to pull them out for therapy? And I tell parents all the time, if your kid is having significant anxiety or significant depression, you might get them to school, but are they really functioning at school? Right? So they might be there in body, right? But they might not be there in spirit. And so that's why you would want to make sure that you are consistently going to therapy to get them to the place where they are functioning the way that they need to function in school and out of school.
Absolutely.
Yeah. Yeah. So Doc, tell us a little bit about our the link that I'm about to upload, and then I'm gonna share it with them.
The link that Dr. Cece is uploading is just the link to my VIP list. And what I do with this VIP list, just by joining, you will get a 4-page document. And the document is free to everyone who goes on the VIP list. And there's 4 things about it. One is, as we've been talking about, it's the tips for finding a mental health therapist. And it's not all inclusive, but it's some great questions that help you guide you through the process. And then the next part is some websites for finding therapists. Remember that there are many options and many different websites. One of the ones I use a lot is Therapy for Black Girls and Inclusive Therapist. This is amazing, and it really gets you in there to find the right kind of therapist for you and your child. There's also what they call Open Path Collective. And Open Path is for people who don't have insurance and they need to pay a fee, but they can't afford a lot. So they negotiate that fee with the therapist. You don't have to do anything. You just call the therapist and say, I got you off of an Open Path, and it's like $39 is a lifetime membership.
Oh,
And then you pay, the most you can pay is 60. Some of the therapists are down to 40 for a session. So
oh
you
wow.
get really good quality therapist, and it's on a sliding scale. So you don't have to have insurance. And that's really important for people that don't have insurance is, what do I do? How do I afford it?
Mm,
And then the other piece of this document that you'll receive is ways to talk to your medical doctor,
mm.
questions to ask, how do I navigate those conversations, as well as what to do when you want a second opinion in the medical realm. So it's 4 pages that's got a combo of mental and physical health items and referrals.
Oh my goodness. So you all, I don't know if you know how invaluable this is, but it is, right? So I can't tell you how many times people call and they will ask about our wait list and we'll tell them how long it is, and they'll say, "Well, do you have a list of providers that you can give me?" And a lot of times, I mean, I will compile one, or like, we have interns that work with us, we'll have them compile a list. But to have all of this information and to have these search engines that Dr. Demeter are talking about, those things, that's amazing. That is absolutely amazing. So we have some comments. Glenisha said, amazing. Thank you, Dr. Demita. And so you all, I dropped it in the chat. And so that is going to my heart and soul page. But as soon as we finish, I will drop it in the chat for LinkedIn as well as in the chat for my personal Facebook. So everybody that gets this video will have it in the link of the video that they're watching. Okay. Or have the link in the comments of the video that they're watching. Okay. So, Doc, thank you so much for being here and helping me talk about this very important topic of awareness, and also what do we do once there is awareness, which is take that next step and initiate. And so I hope you all that are watching live have enjoyed it. When you catch the replay, the people that are catching the replay, make sure you drop hashtag replay in the chat so I know that you have been here. Okay. And if you all want to see more of Dr. Demita, and you should want to because she is awesome, all right, make sure you sign up for that VIP list to get her document. But also, I'm sure Dr. Demita will be sending out emails telling you all about all of the amazing things that she's doing. And if you would like to see her in person in the near future, You can see her at Free Before 40 Women's Conference on Saturday, July 15th, 2023, in Baltimore, Maryland, because she will be here with me at my women's conference. And I am so happy that she's going to be in attendance, and not just in attendance, y'all, she's going to be speaking. So if you want to hear her story, definitely come on by and see us. We are going to be helping women become as free as possible as soon as possible.
Amen.
All right. So, y'all, that is our time tonight. We hope you all have enjoyed it, and we will see you. It might not be next week because I am taking a trip to Alabama for a graduation. So, we might not be here next week, but I will send out a message about the next Dr. CC says. All right.
Thank you
Y'all,
guys for letting me come today. I
of
appreciate it, and I
course.
wish you all a wonderful, wonderful journey.
Of course. And thank you, Doc, for being here. Absolutely. Y'all be blessed. Okay.